Well, there's this conversation happening online tomorrow, starting at noon. It's on Twitter, and it's about 24 community partners are joining in on this.
That's right. I am one of them. So is Jennifer Griswold of Action 3 News. For all of us, the conversation is about awareness, empowerment, and providing insight.
Yeah, Annie Boatwright is the director of the Methodist Sane Start program. Good morning.
Hi, Ann. It's
And
nice
good
to
to
have
see
you
you.
here.
Yeah, thanks for stopping by.
Thank you.
Yeah, let's talk about this because describe the program and the services that Sane Start's involved with.
Yeah, so Methodist started their SANE program back in 2003. A lady by the name of Heidi Wilkie was sexually assaulted, and she, with our Methodist Hospital and Methodist Hospital Foundation, started our first ever SANE program in the city of Omaha. We work to provide care to sexual assault survivors, along with now domestic violence, human sex trafficking, strangulation patients, and elder abuse.
What kinds of professionals are part of that program? If you look at your team, who makes it up?
Yeah, we're all registered nurses at a minimum, and so I have advanced practice nurses, I have midwives, I have nurses that work in the ICU, ER, all sorts of different areas, but they all come together and will provide medical care to these patients, collect any forensic evidence that they need collected, and really provide them with resources so that they can go out and survive such a traumatic event. We also will partner with law enforcement and advocacy agencies to bring forth a team together and make sure that these patients have everything they need.
And I think some of these crimes happen more in the community than we actually hear about, like sex assault, domestic violence, human trafficking. How often are these happening in this community?
You know, our numbers have had a 230% increase in the last 3 years. We went from 137 patients in 2013 to 198
So what's
in
behind
2014.
the increase? What do you point to?
To 314 this last year. You know, I think part of it we hope is an increase in reporting, but the other piece is we are seeing more violence in our community. And that's why it's so important that we come together as a community to get in front of this crime.
This leads us to the discussion that's happening tomorrow at noon on Twitter, right?
Yeah.
So how's this going to work?
Yeah, so tomorrow we have a Twitter event. It's our 4th annual, led by Methodist Health, and the hashtag No More from 12 to 1. And we really want to raise awareness. We want to give prevention tips. We want to give resources out there and demonstrate as a community how we're all in this together and aren't going to accept this violent crime from happening.
I mentioned earlier that I'm doing it. Jennifer Griswold will be on with the conversation as well. Who else is taking part? Because I think this really reflects that it is a unique event and it's a community event.
Yeah, we have, you know, our Nebraska Attorney General's office, we have the Douglas County attorneys, we have Omaha Police, we have La Vista Police, Bellevue Police, advocacy agencies such as the WCA and Heartland Family Services. Some of my SANE nurses are going to be there with us tomorrow. So it's really a wide group of people all coming together and putting aside, you know, what they're there for to prevent this crime.
How does it work if there's people in the community or some of our viewers right now, if they want to join in on the discussion, technically how do they do it? You got to have a Twitter account.
Yep, got to have a Twitter account.
And then what do you do from there?
Follow at Methodist Health. Who's leading the discussion, and hashtag No More.
So you'll be able to follow me at Mary Nelson Omaha. I'll be hashtagging No More. Certainly from noon to 1 o'clock tomorrow, we'll be talking about domestic violence, sex assault, human trafficking. You said this is the 4th year that you've done this now. What were you seeing the last 3 years that you felt like this was worthwhile and you know you're making a difference?
You know, last year we had over 3 million impressions on Twitter.
Wow.
And we really feel like it reaches the demographic that we're looking to reach. You know, it happens most commonly to that 18 to 24 age range. And so this is a way for us to get out to the people who need us most. But it's also a way for us to educate our community and start to change the culture around these violent crimes.
What do you hear from those victims and patients that have come to Sane Start for help, for services?
You know, there's a lot of guilt always associated with them, what they could have done to be different, you know, what choices they could have made. And we always talk about how it's not about what you did, it's about what that person who committed this crime did. And we really start to heal these patients and give them all the resources they need. People need resources. We know that suicide rates are really high among this population after they experience an assault. So we want to make sure that they have every opportunity to not fall victim again.
And I think about before what was happening at Methodist, when you would hear from these victims, and a lot of them would say, I'm not a victim, but they were the target of that crime, when they were the ones who had to go out and get the help and then go to the police department, and they were the ones trying to figure out, where do I go next and how do I piece this case together? Now to have that entire community built around them, that to me has a lot to do with reporting as well, because they feel the support right away when they come in. So the reason we wanted Ann here today was to talk about this conversation tomorrow happening online from noon to 1 o'clock. Please join us. You can tag Methodist at Methodist Health, and then of course that hashtag no more. And it's if you have a story to share, please do. And if it's just about awareness and connecting to resources, please share that as well.
Yeah, very important conversation on Twitter tomorrow at noon,
On
right?
Twitter.
Ann.
We'll see you
Mark
there.
that.
See you at noon.
Thanks a lot.
Thank you so much.
Thank you.
Milton